My name is Roberto Del Loro. I am a professor in the Department of Theological Studies and the director of the Bioethics Institute, which is organizing this evening. It is my pleasure to welcome all of you to the fall Bioethics lecture, which is titled Immigration, Healthcare, and the Duty to Rescue: Ethical Challenges of an Open Society. At the Institute, we decided to dedicate this particular lecture, which, as you probably know, takes place every year in the fall, and we have another important lecture in the spring. But we decided to dedicate this event to the issue of immigration. And of course, the issue of immigration is most pressing, not only for bioethicists, particularly for those interested in issues of global bioethics, but as we know, it is also a central concern in our own national public debate. And so, before I introduce our speakers, allow me a few remarks about this topic of extraordinary importance. I will be very brief. The news of a so-called caravan of over 5,000 refugees from Central America, pushing through Mexico and soon arriving to our US borders, is only the latest story. For sure, the tragedy of people's migration, triggered by social, political, and economical factors, has known a long history, affecting the stability and well-being of entire populations in many parts of the world. The focus tonight will be on immigration and healthcare, a perspective central to the problem at hand, especially in light of the policies implemented by our current US administration. These policies, whether officially stated or simply enforced without clear legal mandate, are cruel enough to warrant moral outrage. One example, for all, might be the treatment of immigrant children, a treatment so ethically problematic that in April 2017, it prompted the American Academy of Pediatrics to issue a public statement against homeland security rules. In the statement, the Academy decries the conditions in which children are detained and the lack of support services available to them. It asks that, in accordance with internationally accepted rights of the child, immigrant and refugee children be treated with dignity and respect, without being exposed to conditions that may harm or traumatize them. So this and other aspects of the issue we face are not without political implications. So we're not going to talk about politics. Yet, the main questions raised by the human tragedy of immigration are of an ethical nature. They interrogate our responsibility as a society that prides itself for being grounded on values of tolerance, openness, and compassion. Should a liberal society, inspired by those values, recognize that the presence of immigrants at our borders, or indeed already in our midst, if only anonymously, entails on our part something like a duty to rescue? So that's the question, which in a way you find in the title of the lecture. If so, then what are the extents and limits of such a duty? And how to understand its priority when a duty to rescue needs reconciling with broader commitments to the common good, so as to be not only prophetic, but also reasonable. So to help us articulate all these difficult questions, we are fortunate to have tonight a great speaker, Dr. Michael Rodriguez from UCLA. There will be his presentation, followed by remarks of our own Dr. Cecilia González-Andrieu from the Department of Theological Studies, who will speak about her work on behalf of undocumented students at LMU. Gigi Macmillan will introduce Cecilia afterwards. So let me just say a few things about Dr. Rodriguez. He has a fantastic CV, and I'll be very telegraphic. So Dr. Rodriguez is professor and vice chair in the UCLA Department of Family Medicine and professor in the Department of Community Health Sciences. He is the founding director of the Health Equity Network of the Americas and founding chair of the UCLA minor in global ethics. He completed his undergraduate training at Berkeley, received his medical degree from UCLA, and did his residency in family medicine at UC San Francisco. Not happy with all these degrees, he decided to continue on for a Master of Public Health at Johns Hopkins University, and more recently, he was a Robert B. Johnson Clinical Scholar at Stanford University. Dr. Rodriguez is a prolific scholar whose research activities focus on health, equity, and social determinants of health. He has consulted for the World Health Organization, UNICEF, the Pan American Health Organization, the Centers for Disease Control and Prevention, and the Institute of Medicine. Finally, he is also a board member of the Blue Shield of California Foundation and Latino Coalition for a Healthy California. So a very impressive speaker whom we are fortunate to have with us tonight. Please join me in welcoming Dr.
Good evening, and thank you so much, Roberto, for that very kind introduction. I didn't just finish Stanford, but I'll take that for sure. And I am honored to be here at LMU. It is a great pleasure to see smiling faces and eager people come here at this hour to yet listen to another lecture. And I'll have to say that for me, the opportunity to come here and to speak at this institution that aspires to promoting social justice in the world is one that I ascribe to in terms of what I try to promote in my life and in the work that I do. And that's partly because I'm also, as many of you may be, a child of immigrants. And so my mother is Mexican. My father was from El Salvador. They both migrated before I was born. And so I grew up the life of a child of parents whose primary language is or was English, Spanish, that is, and so and dealt with all that children have to do in that role frequently, in translating and helping out in clinics and whatnot, as well as in the world that was evolving after the civil rights and recognizing all the different changes that was happening, not only with regards to racial rights, but also the rights of women and feminism and many other movements that were happening that transformed me as well. And so this story of immigrants that Roberto introduced and made some comments about is a story that's my story as well. And in terms of being able to overcome some of the challenges that we'll talk about at this talk. and be able to be here to get this job done. And so one way I wanted to start this was a little bit different than perhaps some of the talks that you may go to, because I wanted to give a clip from an American musical that you may have heard about. It's titled after an American president named Hamilton, and this little clip. So I'm going to cue it up here. This little clip is just a small piece. Some of it's in Spanish, so there's subtitles for those of you who can't understand Spanish. But it talks about some of the issues that immigrant populations and immigrant families and immigrant children experience, and the feelings, and does it in a dramatic way as well as in a musical way. So on that note, I'll cue up this piece.
Por tierra, por agua, identidad falsa. Brincamos muros o flotamos en balsa. La peleamos como Sandino en Nicaragua. Somos como las plantas que crecen sin agua, sin pasaporte americano, porque la mitad de Gringolandia es terreno mexicano. Hay que ser bien hijo de puta. Nosotros les sembramos el árbol y ellos se comen la fruta. Somos los que cruzaron. Aquí vinimos a buscar el oro que nos robaron. Tenemos más trucos que la policía secreta. Metimos la casa completa en una maleta. Con un pico, una pala y un rastrillo, te construimos un castillo. ¿Cómo es que dice el coro, cabrón? Immigrants, we get the job done. Look how far I come. Look how far I come. Look how far I come. We get the job done. Look how far I come. Look how far I come. Look how far I come. Immigrants, we get the job done. Look how far I come. Look how far I come. Look how far I come. Immigrants, we get the job done. Not yet.
Thank you. So, immigrants, we get the job done. Has been a subtitle to my life in some ways, and the other ways it's we get the job done and no one ever knows that we get the job done, whether we're taking care of families or we're taking care of gardens or we're in a construction site or we're washing cars as the car washeros do, or many other types of work. And so contributing to society in many different ways, and the issue of ethical challenges of an open society is one I want to talk about. Can you raise your hand if you have a sense of what it means to have an open society? Fantastic. Okay, so when we talk about an open society, we talk about having a government, perhaps, that is responsive, tolerant, transparent, and one that has certain principles of political freedom and human rights, some basic principles. And so I'm going to talk a little bit about political freedom, freedom from oppression, as well as any disabling conditions. And importantly, it's fulfillment of enabling conditions. Those conditions that enable someone to fulfill their lives, to move forward. Those are extremely important components. This lecture looks at these general issues and also issues of human rights. And when we talk about human rights, we talk about rights that are fundamental for humans. Humans, no matter who you are, it's not about any characteristic other than being human. Based on a sense of a natural law, what should be, what's a norm? And not only that, but they're universal and they're timeless. So extremely important to have this sense as a fundamental consideration that is that's a premise of this talk. And if we feel that people deserve some basic human rights, well then that means that you should be aware that most of the countries on this planet feel that as well. So you're in good company. And these human rights have been enshrined in many different documents, and I'm just demonstrating a couple of them here. They're enshrined by the Universal Declaration of Human Rights that recognizes the right to health also, that it derives from the inherent dignity of a human person, as well as the International Covenant of Economic, Social, and Cultural Rights. And so these two recognize this dignity of individuals to have a right to health and health care. Those are critically important issues. And so based on that, it's important to have a sense of, well, what do we mean by health? And this cartoon here gives you a sense. It's a pictorial. You know, when we talk about equality, it has this box, these boxes that these three people are standing on. All the boxes are equal. Everybody gets the same box, gets a box. But it's different than equity. Because, as you could see from the equity side, well, some people actually have a box, but they don't need a box to see. The middle person just needs one box to see, and the third person needs two boxes. So equity is providing everybody with the opportunity to see. And for some people, so that it means more than everybody just getting a box. It means getting the boxes that you need to enable you to see in this metaphor. Or in other words, to promote good health, a society can, if it will, design and build effective institutions, social systems, structures, and practices that support all members in the pursuit of health equity. And so when we think about health equity, it has, this is a wordle, I guess we were called, with all the different words that come up when you think about health equity. But it is about every person, regardless of who they are, color of the skin, level of education, gender, sexual identity, whether or not they have a disability, immigrant status, job they have, etc., has an equal opportunity to achieve optimal health. That's the fundamental principle. And so a question I present is, if you believe that everybody has those basic rights, then what does that mean? Well, let's think about what that might mean for immigrants. And before we talk about immigrants, let's get the common definitions of what we mean when we think about immigrants. So, so on one level, when we start to get into immigrants, one thing that we can, an immigrant starts off is somebody who's not a U.S. citizen. Okay, and the categories when you're not a citizen is that you're either an immigrant or not an immigrant. You might wonder, well, what's an example of a non-immigrant? Any thoughts? Tourist, student, excellent. So students, temporary workers, visitors, right? Tourists, other folks who are there temporarily, okay? Visas allowing them to be there only for a limited amount of time. But when we think about immigrants, that's a person who's residing in a country that's not the same as their birth country. And it includes these categories of naturalized citizens, lawful permanent residents, certain legal non-immigrants, refugees or asylum seekers, persons illegally in a country as well. And one of these categories that we are hearing about a lot in the news as well are students who have deferred action for childhood arrivals. And so, so I thought I'd just put what it means. You know, maybe not everybody may not be aware of what you mean by DACA, but it's a form of protection from the government from being deported. Recognizing that these individuals were under 31 as of June 15th, 2012, came to the U.S. before they turned 16, have been in the U.S. since 2007, and if school, have a GED or a high school degree or served in the military. They can work and at this point cannot apply for a green card. So they're here. Many of them are students here at LMU, students at UCLA where I'm at, and students who are doing great, and our leaders, as well as people out there who are in graduate, not only undergraduate but also graduate school and postdoctoral levels, and doing work as well. When you think about the issues that influence why do people move, right? What is it that has influence? Well, there's some factors related to what we refer to as push factors, okay? What things might push somebody to move out, and other factors that are characterized as pull factors. Push factors are manifested here on looking at this slide on your left-hand side: war, problems with economic opportunities, natural climate change, natural disasters, persecution, food shortage. And pull are the more the opportunities for work and food security, freedom, opportunities to be reunited with your family, opportunities to benefit from a climate that doesn't suffer so many natural disasters. So these are some of the major categories of factors that influence why a person or people change from being in one country and moving to another. Or in some cases, people who may move within a country to another place in that same country. Many things that people hear about in the news are not so positive when they come to talking about immigrants. And it's important to recognize that there are an enormous amount of contributions that immigrants make to any society that they become a part of. Whether it's filling labor needs, paying taxes, adding diversity, sharing new ideas, enriching the culture in which they become part of, offset, if they're young, they offset an aging population frequently, as well as strengthening our global connectedness. The infographic here talks about some of the contributions related to an economic aspect and shows that in the state of Washington, that immigrants are 13% of the population, they're 17% of the labor force, they're 15% of small business owners, and they're 14% share of the economic output. So many different contributions. In the U.S., the U.S. has more immigrants than any other country. Since 1965, the U.S. immigration population has more than quadrupled to 43.7 million. That's in 2016. In 2016, women accounted for 52% of all migrants in the U.S. And 76% of all immigrants are in the U.S. legally. They're not distributed equally throughout the United States. And this is a map of immigrant populations across the United States. And you can see how, and there's approximately 20 metropolitan areas with the largest number of unauthorized or undocumented immigrants. That's as of 2014, with the circles representing a larger proportion of the populations. And so you can see in what ways where they are, where their large populations are, although immigrants, both documented and undocumented, are in every state of the United States. They also face challenges of poverty, in terms of having a higher percentage of folks who are immigrants who are in poverty than those who are non-immigrants. Employment, approximately 83% of immigrant households live in a family with at least one full-time worker. That's equal, if not higher, than populations who are non-immigrants. And in terms of health insurance coverage, they have amongst the highest percentage of population with no or limited health insurance. 39% of undocumented immigrants are without insurance, and 23% of undocumented immigrant children are without insurance. If you think about the implications, it goes far beyond whether an individual has insurance or not, especially when you consider the many other millions of who are part of the implications when you look at households that are mixed. Mixed status households means that at least one person is undocumented. And so in those households, then the impact of one person having limited access to health care impacts the access to everybody else because of the concerns. In California, we have about over 10 million immigrants. It's slightly over the 1/4 of the population of California. 30% reside in 7 counties, and most are documented residents. 49% are naturalized U.S. citizens, 26% have some other legal status, and 25% are undocumented. When thinking about health and thinking about the factors that influence the health of people, it's important to think about, most folks think, well, that's about doctors. I'm a family physician, and I know, and I learned very quickly, especially when I was working at county hospitals, that that care for some of the most impoverished of wherever those county hospitals are, that the health of people go far beyond what we in medicine can do. And so that's why, in order to address the health of people, we need to go beyond health sectors. This is a figure here that looks at some of the variety of different factors, frequently referred to as determinants or social determinants of health. And some of them are broad, are individual. If you go in the middle, age and sex or gender, other sort of individual factors. Then there's individual lifestyle factors. Within that, you're in a community, right, where there's social and community networks. And then you have a variety of other factors, such as food, things related to food, education, the work environment, living and working conditions, unemployed, water sanitation, healthcare services, housing. All of those factors, which frequently are described as where you're born, where you grow up or play, where you live, where you go to school, where you work. All these factors are significant with regards to how they impact our health. And all of that also in the context of general socioeconomic, cultural, and economic environmental conditions. So all of these separate factors are much stronger than healthcare, although healthcare is one piece, but it's part of something much more complex. And these factors are interrelated and interconnected. So they're not isolated factors, but really when you think about it, they're factors that come together. And so the people who have housing or don't have housing, and also are in communities that have sort of a limited amount of parks and green space and places that are safe, and work in homes that have work in jobs that sort of pay limited amount or have limited amount of benefits for their workers, etc. So these things frequently tend to come together. It's important to understand that these different levels of factors come together when you're thinking about health, and also when you're thinking about what to do to promote health. For immigrants, there's another dimension, and that's the dimension of thinking about the migration process. Now, as a society where we have policies and practices that dictate the resources that are available, the way that we plan homes or communities, the schools, the number of schools, the number of teachers per student, the minimum wage that people are paid, etc. Well, we know that some of these are deliberate, these policies and practices that happen. Some are inadvertent, and some are historical, some current day. And they're enacted by and across sectors that have contributed to sometimes health disparities, the differences that we see in terms of health, frequently across socioeconomic lines, by shaping these determinants of health that I just described, which are connected to health, safety, and health equity. So these policies are manifestations of how we do work and how we do business in society. For immigrants, when you're thinking about their health, you have to first think about it. You can think about it in three different phases. There's the health before they immigrated, and the conditions that they were in, and they had, and the resources that they had. There's the process of immigration. So it was just described before this started, the caravan and the challenges. What's the what's one of the reasons that there's so many people traveling right now together? Safety. Yeah, safety. So people come together because it's dangerous. Because when you're not with a big group of people, you sometimes are in danger. You sometimes get harmed, experience traumatic events. And so by being in groups, you help enhance your safety. So, but what happens during that time has an impact on your health. And then, of course, where you arrive and stay, that's significant. All these issues are important from a theoretical perspective, but of course, they're also important from a real perspective, from a real lived perspective. One of the issues is the broad sort of cultural perspectives on immigrants. And these days, many times in the newspaper, you don't hear positive things about this wonderful caravan of people and all the wonderful things that they're going to bring here. Well, it's not the first time that groups have been treated this way. This is a picture that's at the bottom entitled Uncle Sam's Lodging House. And so this was over 100 years old, and it talks about, well, the person, Uncle Sam, that represents the United States. It also has Lady Liberty, who's covering her ears, and then it has these different groups. They're in boxes. They're called Irishmen, Englishmen, German, etc. This is a cartoon, right? Social commentary. Cartoons that we have these days, that are in our newspapers or other places, that sort of are ways of where social sentiment is being expressed. And so all to say that what we're seeing with regards to the characterization of immigrants by some is not new. It has happened historically, and some folks identify it as stoking fear. This long history of scaremongering and discrimination has created barriers for those in most need. And this is a timeline that just identifies some of the major events that have happened since the 1800s, where the immigrants were accused of bringing cholera to the United States. Or in 1891, there was the Immigrant Act of 1891 that restricted immigration, including a ban on those from, quote unquote, loathsome or contagious disease, suffering from them. In 1900, the Chinese community of San Francisco were targeted for compulsory experimental bubonic plague inoculation. In 1916, the Italian immigrants were singled out for causing polio outbreak in New York. In 1952, the McCarran-Walter Act excluded immigrants who were unlawful, immoral, diseased, or politically radical. 1987, they had the National Institutes of Health Revitalization Act that added HIV as a criterion to keep out immigrants. And more, right? The images that we have are myriad with regards to the ways in which we have looked at immigrants. And the image and the words of a wall come up frequently. This is a cartoonist who did this to poke fun. And there are, it's called there's a rock that says Plymouth Rock, and the Native Americans. And then there's these, what look like they maybe are dressed as, perhaps we would call them pilgrims, that are approaching land. And then the bottom says, they say they're building a wall because too many of us enter illegally and won't learn their language or assimilate into their culture. Some things are kind of funny. It's poking humor at real life. Some of them, this is a picture of somebody with red hair. And it says white supremacists, neo-Nazis, law and order, Mexican rapists, disease-carrying immigrants, deport them all, Jeb Bush should speak English only, a silent majority. Again, that's from the cartoonists. Unfortunately, the reality is that the challenges are great that we're facing. In fact, the current policies impacting migrants are numerous. They include a travel ban, tax or taking away deferred efforts to take away deferred action for childhood arrivals, Department of Justice threatening to tighten asylum laws, termination of temporary protected status, immigration court attacks, children and family separation policies, zero tolerance immigration criminal charges, as well as proposed new rules on public charge. And that's just a subset of them. Many issues that create a context that challenge many of these determinants mentioned earlier with regards to determinants of health. So when we think about immigrants and we think about medical ethics, we are taught, I was taught about not inflicting harm on patients, a positive duty to contribute to the welfare of patients, justice or fair treatment of patients, and respect for patients' autonomy. And the thought that some folks, that the issues that happened in 1963 around having an only whites school and efforts in 2011 to make that happen for immigrants, Latinos in particular, is one that, for me, pushes the boundaries of the ethical principles that we're talking about. And when we think about ethical issues, we think about the myriad, the approaches of justice-based approaches for health, and recognizing that many key threats to health and well-being are beyond the control of individual states, states being countries. And that in order for us to move forward, it's important to include numerous players involved with improving the social determinants of health for migrants. That may include government individuals, nonprofit organizations, the private sector, environmental organizations, as well as education and healthcare and others. These are all important issues. While moving forward, numerous challenges happen with regards to an ethical approach, some being a lack of unity. The thought that health is only a domestic issue and that perhaps citizen health is more important than migrant health. Not recognizing the universality of some of these rights that we talked about earlier. Health response, diverse and specific with regards to diverse or geographic, sociopolitical, and legal contexts. In California, one of the most progressive states there's a wide variation with regards to some of the local resources and resources available to immigrants. And so it's important to consider when thinking about policies how to be broad while being specific. And at the same time, there's sometimes tension between migrants and those who were here before. Many host countries have concerns about threats to employment and feelings of economic disadvantage and inciting, targeting behaviors towards migrants. These are the fears that are frequently stoked, as I talked about earlier. And fortunately, fears that some organizations have identified as danger to health. This slide here identifies how the American Medical Association has recognized the role of scaremongering as a health issue and has passed up a policy in 2015 that we were involved with to ensure standard public health screening indicated prevention for all immigrants, regardless of legal status, advocating for them to have information and to effectively deploy resources needed to eliminate health disparities affecting immigrants, refugees, and asylees. So what's next? Well, we need to ask ourselves, if we believe in human rights and a right to health, then what models do we move forward with? Do we frequently approaches fall between an integration model, which is one that wants to invest in immigrants, views immigrants as a vital part of our society, recognizes economic and cultural contributions of immigrants to the US society, or a marginalization model, one that wants to reverse the flow of immigration, creates divisions between immigrants and citizens, documented and undocumented immigrants. Which one do we choose? And how do we move forward? Well, from a bioethics perspective, it's important to frame and analyze challenges concerning care for migrants as problems of justice. And so I'm going to move forward because I think we're getting close to my time to end. So, so there's issues involved with integrating learnings within teaching related to bioethics and also to integrate teaching and learning and organizational ethics and public service, aiming to understand and reflect the local implications of a national policy. How do we move forward in a way that's ethically supportive of the values that we feel as a society that everybody has a right to? 3 is ethical theory, accounting for the migrant and her or his children. This includes many different theories and ways to approach this. And also thinking about the dimensions of public health and how that can contribute to theory, research, and policy concerning recommendations concerning the duties to migrants and to their children. And for local authorities, well, frequently things happen at the local level. And if any, have little, if any, say over national immigration policies, but as reports like this highlight, they can do things to promote a sense of inclusion, better integration amongst migrants in the communities, working with local authorities and city professionals helps to encourage awareness of resources and capacity building within new populations. What we want and the implications of this go far beyond immigrants in terms of human rights and what everybody and our duty as a society to support them. And so these are just photos of some other populations that are also have been where the questions to the rights that they are eligible for has been questioned. Next step, well, resources. It was mentioned that I helped to start this new network called the Health Equity Network of the Americas, an intersectoral network dedicated to promoting health equity and equality in the Americas, especially for those groups living in contexts of vulnerability. The website's down here, and I'm happy to give it to you afterwards if you're interested in learning more about it. Other resources include Protecting Immigrant Families, National Immigrant Law Center, American Civil Liberties Union, International Organization for Migration, and I'm just highlighting what's on your webpage here at LMU, but some resources here for students, both on-campus organizations as well as off-campus organizations. Immigrants and their children are here to stay. They face a number of health needs that merit attention, not hysteria. We can rise up to ensure that human rights and these health issues are taken seriously for a healthy California and a healthy United States. Thank you.
Thank you, Dr. Rodriguez. I really appreciated your remarks. My name is Gigi McMillan. I'm the program administrator for the Bioethics Institute. It's my privilege to introduce our next speaker. Cecilia González-Andrieu is an associate professor in the Theological Studies department here at Loyola Marymount University. Her scholarly writings explore theological aesthetics, educational justice and access, Latino-Latina theology, and the theology of Pope Francis. She also writes on immigration, education, and current political concerns as a contributor for the America magazine. She's the author of Bridge to Wonder, Art as a Gospel of Beauty, and co-editor of Teaching Global Theologies, Power and Praxis. Tonight, she will speak to us as the leader of the university's work with undocumented students.
Thank you. I don't know if this is on. You guys hear me okay? My students back there? Just want to make sure they hear me. First, I want to express my gratitude to the Bioethics Institute and to Dr. Roberto Del Oro and his team of Gigi McMillan and David Rogoff, because they prepared this really stimulating and important moment of us gathering. And most especially, I want to give my mil gracias to my nuevo amigo, Dr. Michael Rodriguez of UCLA, for doing something so vital, by helping us to have a clear perspective, right, of the extraordinary challenges that are facing us, and so that we can really try to discern our role in meeting this heartbreaking reality. So I've been asked to speak briefly about our context here at LMU as it relates to immigration advocacy and on behalf of what I call immigration vulnerable students. And I hope that this glimpse will open a window into some of the challenges that are faced by institutions of higher education. Now, I can trace my work on immigration at LMU to over a decade ago, when a young man in my theology course came in for advising. He was a singularly brilliant and ethically committed student. And when I walked around campus, I always saw him involved in student activism and with tons of people around him. He was what many of us would call a dream student. But what he disclosed to me that day was that he was also a dreamer. Jose wept with me as he recounted his loneliness, the isolation of being an undocumented student, and on this particular day, his heartbreak, because he couldn't accept one of the key positions on our student government because it was a job and he wasn't authorized to work. Now, we were able to work out the situation, and Jose volunteered his work as ASLMU Director of Social Justice, while the funds for his job were repurposed for initiatives that would respond to our commitment to the service of faith and the promotion of justice, or how I like to say it, faith that does justice. So at the end of the semester, Jose produced an art project for class based on the way of the cross. And as we've heard from Dr. Rodriguez, the way of the cross is the way of a lot of immigrants. And he gave us this glimpse through his eyes. For station number 4, which is Jesus meets his mother, he wrote, "Surround yourself with people who believe you can." And for station 7, which is Jesus falls the second time, he reminded us that the best way out is always through. For station 10, as Jesus is stripped of his clothes and humiliated, Jose wrote, "Standing your ground is progress when you're battling a hurricane." Finally, for the last station, as Jesus is placed in the tomb, Jose gave us a glimpse of his own young heart. I haven't a clue how my story will end, but that's all right. When you set out on a journey and night covers the road, that's when you discover the stars. I have been blessed with many transformative conversations during my years at LMU, but that first hour I spent in active accompaniment with Jose set off a chain of events that continue to reverberate in complicated ways today here on the bluff. You see, the thing Jose needed most from us was that we would see him. He needed to feel whole, accepted in his painfully vulnerable truth. And more, he needed to contribute to our community because the fire of social justice burned bright in him. Following our conversation, I met with a respected senior colleague, Herbert Medina, who is now the Dean of Arts and Sciences at the University of Portland, and I learned of the quiet work he had been doing on our campus for many years, securing funding for one scholarship for an undocumented student to graduation. What Jose's honesty called us to do was to try to meet the challenge posed by young people like him. Some of them are here tonight. It has been hard work. And sometimes we have only moved inches at a time. But in the decades since the issue of immigration, vulnerable students has come out of the shadows. It's come out of the shadows not only here, but nationally. And we at LMU have been present for most of this difficult story. The Bipartisan DREAM Act, its multiple defeats, and its reintroduction multiple times. It took us to Washington, D.C. as advocates and caused our newly constituted student group for Dreamers and for their allies to name themselves Resilience. Challenged to find resources, the university dedicated 5 scholarships to funding undocumented students, so that every year we have not only Jose, but 25 of these outstanding young people who form our social justice scholars community. Their presence among us reminds us of the utterly priceless character of a university education. And we stay in touch with our graduates who have gone on to law school, medical school, seminaries, and graduate programs, and with those who are teachers and career counselors, engineers, scientists. They are singularly generous, putting their professional selves at the service of others and returning to LMU to speak to the new entering classes and to offer themselves as mentors. Jose also helped us to see that a young person in this situation doesn't only need a scholarship, but an entire community of support around them. This year, we have begun a program to pair up one faculty member who is a faculty advocate with one of our students. And working with them reminds us every day of the reason we're here. My colleagues on the faculty have been so generous that I actually have more volunteers than students. Already in the couple of months we've been working this way, we've identified new needs, which will help us develop new initiatives. We have created a community of support under the leadership of the LMU Undocumented Student Advisory Committee, with staff and faculty and administrators contributing jointly through multiple areas of the university. In all this, we have built a network based on our commitment to encouraging, learning, and educating the whole person. A commitment that mobilizes our LMU resources in support of these students who need us. So as a theologian, I like to keep a vision of God's beautiful kingdom before me, one where every single member of creation is loved and cared for. And so I want to conclude with some of the dreams that I think our LMU community of support shares for these young people. First, we dream of more scholarships, not 5 per year, but 10 or 20 or more, as at some of the other institutions. We welcome named scholarships, endowments, anything. If you know of someone with a big heart and wish to contribute, send them our way and tell them to say, it's for the social justice scholarships. Second, we also dream of a day when these scholarships go to brilliant and deserving students who no longer have to fear their deportation and for the safety of their families. So we invite you to use your vote and your civic voice to bring about comprehensive immigration reform. Become informed on the position of candidates and their record on developing legislation that safeguards the immigration vulnerable in our schools, at the border, in detention centers, and around the world, braving the most difficult situations imaginable to flee to safety with their families. This is a major priority for Pope Francisco and for our 3 founding communities, the Jesuits, the Marymount Sisters, and the Sisters of St. Joseph of Orange. And as they said in their joint statement protesting the Trump administration's rescission of DACA, quote, "We are called not to despair, but to action rooted in hope." Finally, our students and all of us who support them ask you to remember their families. That while these few young people are here, their families, like all of the families that constitute the millions of vulnerable immigrants in the world, are struggling against great odds. Look around you. See where you may be able to help concretely and intimately to lessen the burdens of persons who are suffering much because of what is only an accident of history. We're all God's beloved. So I invite you to go out and love much. Thank you.
Very well. It's time for questions and answers. Of course, Dr. Rodriguez has to come to the table together with Dr. Cecilia. Please, questions?
Yes, back.
Yes, if you could state your name and your affiliation and for whom your question is raised.
My name is Alex. I'm a part of the Bioethics Institute. My question is for Dr. Rodriguez. First of all, thank you so much for sharing your ideas. Really enlightening. Wrote down my question. Hold on. So a lot of the ideas you talked about were in regards to this notion of xenophobia, a fear of immigrants, or mischaracterization as a threat, as immigrants being a threat to America, which I believe is a wrongful characterization, absolutely. While I agree that's happening, I'm left wondering, isn't there a serious discussion to be had about distributive justice? As we all know, America has its own vulnerable and disadvantaged populations as a result of socio-historical oppression, such as 40,000 homeless vets who currently live on the streets, minority populations living in poverty in the inner cities, and even immigrants who migrated to the U.S. legally. So my question is, and it's a two-parter, does not the United States have a greater obligation to help citizens and immigrants who entered lawfully over people who, while having honest and good intentions and are great people, have broken our laws to enter? And is it racist to believe that open immigration may be harmful because it would reduce the resources available to vulnerable people who are already here lawfully?
Thank you very much.
Thank you very much for your question. And I'll start, and if anybody wants to add, they're welcome to add. From a health perspective, disease knows no borders. And so when a patient comes to me, I don't ask them what their legal status is. I'm just here to take care of them. And because if they're not taken care of, they not only potentially suffer them more themselves, but also put other people at risk. And so I don't look at it as an either or, because it's not about whether we should take care of those populations that you mentioned already, or we sort of focus on these new immigrants. We need to do it for everybody. We need to have a society that does protect our communities, all communities, and does not label one community as more deserving than another community. All communities, all humans are deserving. And certainly, anybody who's here should be treated as well as possible, and as I said earlier, should receive the basic necessities for them to move forward and for their families to move forward. At the same time, we're part of the world. We're not an island, and that the more that we can work with others and recognize our part as part of the world, and that when we help the world, we help ourselves, I believe it's important, and a duty also, to provide that support. And there's a variety of ways to do that. Any other additions?
Sure. Yeah, I think although we hear that rhetoric often, it's really a false dichotomy. because it assumes that there's only a finite number of resources, and that if we give them over here, they will not be over there. Ideally, a society that says is founded on Judeo-Christian principles would say is, we will develop resources and we will collaborate with one another. I mean, if our story of LMU says anything, is that if you want to make something happen, you bring a lot of goodwill people together to make it happen. And so the idea that we can have more resources, I think, is a good one, especially because we prioritize things so wrongly. And so I'm all for like paying basketball players, you know, a nice amount of money, and then have the rest, just all the other millions, go to build a hospital and have some sanity in our economies, because our economies are so topsy-turvy and really penalize the most vulnerable people among us. Now, as a theologian, I also have to say that the idea that there's a greater duty to one group of people than to others is untenable in a Christian understanding. Jesus has in no way given us permission to make that kind of judgment. As a matter of fact, you know, the neighbor is actually every single human who needs you. And he reminds us, of course, that when we do help that most vulnerable person, it is him who we are helping. So we can't claim, on the one hand, a convenient Christianity when it serves our purposes, and then jettison its difficult demands, which one of them is this one.
If I may add something to the observations that have been made, which I think are very instructive. And I know that, of course, the questions of priority are not, how should I say, useless questions, are questions that ought to be posed. At the same time, I think we have to define exactly what should be the sort of theoretical framework within which the question is being posed. And I'm not sure that when it comes to the issue of healthcare, the framework should be only the framework of distributive justice. So in other words, when we think about allocation of resources in the area of healthcare, we're thinking about something that is very different from, say, when we think about allocating cars or allocating goods of a material nature. And so for me, the framework is also the framework of distributive justice, but first of all is the framework of what traditionally is called commutative justice. So in other words, it's the question of what I owe a human being on account of the fact that the needs of a human being cannot be prioritized, so to speak, but have to be addressed in their own reality for what they are. That also goes to the problem of how do we understand the meaning of a right to healthcare, and whether because of the nature of the good that healthcare is, we shouldn't be thinking of a right to healthcare along the lines of, say, a right to free cars. And that, to me, is the way in which, especially here in the States, we tend to think about healthcare as a good. So, if it is a material good, then the language game of distributive justice is the proper language game. If it is a question of a basic good that in fact defines the vulnerability of a human being, to which you have to respond as a human being, otherwise in not recognizing the humanity of the others, you fail to recognize your own humanity. So if that is the structure of the relation, then the problem is a problem of commutative justice more than distributive justice. As a doctor, I have 10 people coming to me, I'm not going to ask who is an immigrant and who is not an immigrant. What I owe them has nothing to do with the problem of distributing resources, but in fact with the problem of addressing directly, meaning commutatively, the needs that the person coming to me has. So I'm not denying that there isn't a problem of distributive justice as well. And by the way, my colleague Nick Brown, who is teaching a wonderful graduate class in justice and healthcare, which I suggest everybody takes, would have much to say about the specific issue. But I simply want to highlight the fact that if we frame the question in terms of distributive justice only, we might be on the wrong track as to the possibility of answering the question.
Thank you.
Brian?
Yeah, sorry, I'm back here. My name is Brian Traynor. I'm a professor in the Department of Philosophy, and as a philosopher, I'm interested in making sort of clear and strong arguments. So I don't want to take issue with the conclusions that any of the panelists have drawn. I'm sort of broadly sympathetic to an open society and much of what's been said, and Cecilia and I have spoken about this before. But I wonder if I could push you almost the opposite question from the previous one, just to help us make a stronger argument for your conclusion, which I want to agree with, right? And so, if healthcare is a basic fact that we owe all humans on the basis of their humanity, what is special about the position of immigrants, whether documented or undocumented, to the United States? So I don't see a particular reason that anything magical happens when a human being crosses the Rio Grande, that all of a sudden on the north side of the Rio Grande we owe them dignity and healthcare and everything else, but somehow on the south side we didn't, right? So if the criteria for us to consider isn't going to be a administrative and bureaucratic criteria about whether or not they had the proper papers when they came here, we're going to look just at their humanity. Their humanity was the same on the south side of the Rio Grande as it was on the north side of the Rio Grande, right? And so presumably then, on the basis of what's been said, we owe a similar duty to care for people even if they're not immigrants. But the problem here is that while I absolutely agree with Cecilia's last problem, that we've got a lot of issues here stemming from an upside-down socioeconomic system that has absolutely the wrong priorities. And we could free up a lot of resources by somehow turning that right side up, although that would be a large task. Nevertheless, once we extend our concern to all humanity, then I think even if we radically redistribute things, we are coming up against a situation in which there are not enough resources to equally care for everyone. So I wonder if you can just help tighten up the argument for me to reach the conclusion that I want to reach with you. Thank you.
Okay, Brian? Thanks. I think what I want to say is that we take the circumstance where we meet the circumstance. And in the work that I do on campus, beyond our undocumented students, with our custodial workers, the circumstances under which particular people live, as Michael showed, right? All of those concentric circles are going
Can you use the other mic? That one's skipping. Can you use the other mic? We can't hear you.
Oh, I'm sorry. Okay. Is that? Yeah. Second? Okay. So the circumstances of the concentric circles are going to be radically different depending on who this one person is. So I really like the graphic of the different boxes. And I like the idea that we have to meet each need where it's happening. So I completely agree with you that their need is as great across the border as it is here, and I think Michael's group's addressing that because of this global initiative that they're involved in, right? And so for me, one of the things that happens, especially when I work with our custodial workers, is to look at all the barriers and how different it is for me to access something than it is for them to access something. So that extra mile, that extra box, that extra help needs to be put in place, and it's our responsibility, I think, to put it in place. Now, on the other side of that, he also in the image had the guy who didn't need the 2 boxes. And so I think a resolve, which I know you make and a lot of my colleagues make, to live simpler lives so that we may put resources in other places, is also a virtue that we would want to bring to the foreground. Clearly, the more amassing of goods that's done on one side, the less there is on the other. And so it is an economic issue. It's an issue of a pragmatic issue, as Michael has said, of if this person gets sick, then it affects a chain. It causes this chain reaction. So in the end, right, if we want to have, for me, that vision of a beautiful kingdom, that's what's got to pull me. And the decisions happen one at a time, and in a context at a time. That's all I got.
I'll just add a couple cents. And thank you for your question. And I guess I'll underscore what Cecilia said about, in my experience, if you really want to do something, you find a way to do it. We certainly, as a country, have done that in many ways. In some ways that I don't agree with, but we found a way. It's also a fact that in most of the developed countries of the world, they provide more health care to the populations in their country than the United States does for much, much, much less money. And so it's a problem, and it's a real problem. And I firmly believe it's a problem that we can solve, because there are ways, perhaps different ways, that we have to do things in order to reach the good that we all believe in. And sometimes it's not a simple thing. Sometimes people have to have less, who can, frankly, in most cases, live with less, in order for some to have the basic amount to live a basic life. And so, from my perspective, those are realities that we face as a country and as part of the world, because I agree with you, there is nothing that changes the person by crossing some imaginary boundary or border. It really is just the same person who's deserving of care.
If I may, I wonder whether the issue is only one of logical argumentation. I mean, it's not only tightening the logical argument, but also straightening the ethical sensibility of the society. So the issue for me is really the issue of what we value. And so when you compare the kind of money that we as a society are willing to give to something like defense or something like entertainment, and what we are not willing to give for, say, healthcare, we have a clear understanding of what our values are. So I think it has to be also a question of what kind of society we want to be. Of course, the issue is not that simple, I understand, And of course, we need to articulate a clear theory of justice. But it's really what we value. Because there are clearly some things that we value a lot, right? And other things that we apparently do not value. And specifically in the area of healthcare. In, what was it, 2006 or 7, we in California decided that we are willing to put down $3 billion, which now, of course, have become 6, to establish the Institute for Regenerative Medicine that would carry out experimentation on embryos in order to produce supposedly therapies as a result of stem cell research. And of course, we know that the move was done in order to boost the biotech companies in California more than to boost the potential for therapeutic outcomes. We voted in favor of that. So that's what we did. We could have done, wait a minute. How about providing healthcare for everyone, for all the uninsured in California? And we said, no. We prefer to make sure that some of us will have the little clone in the closet so that they can use it in case of need. Those are choices that really have to do with our own ethical sensibility. And that's, in my opinion, what is especially at stake in this conversation.
Although your outcomes are really important, for me it gets to be even more of a fundamental question of, are these outcomes going to come to be through coercion of the state and the power and authority that they have over our lives through legislation? Or are they going to come to be because people individually choose to do the right thing? And I know it's not one or the other, but in the kind of dream societies that you guys have talked about in your addresses, what kind of percentage do you see it on a kind of continuum? Is this mostly going to be people getting their act together and deciding to do the right thing? Or is it going to be the government saying, you know what, we're going to tax you more, we're going to put your money towards this to be able to make sure it happens? And a good example of this is with having it mandated that one must have insurance to begin with. I'm old enough to remember a time that insurance was something that was a benefit that you got from your employer, and it was still a choice that you had. But because of the way insurance works, I don't have a choice not to be insured anymore, no matter what my health is like. I don't have that choice anymore. It's taken away from me because of the mechanism of insurance. So those kind of things need to be addressed as far as, am I losing my free will to be able to bring this utility to pass?
Well, the first thing I would say is that in a supposedly democratic society, we have a government by the people and for the people. So I don't think we have a dichotomous relationship between government that a society is bringing into being and to do the kinds of things that society believes are actually good for that society. And the responsibility that we have, which I think is huge right now, to get a government that does not do the right things by its society out of power so that we can indeed do the right things for the society. And in terms of your question, or speaking about having the right or not to have insurance, I'm a cancer survivor, and I know that I am a really fragile organism, and that even if my brain would want to tell me that I'm not going to get cancer, guess what? I get cancer. And so that I think that sometimes human beings don't make the best choices for ourselves, and that sometimes we do need to trust experts who tell us You know, might be a good idea. Now, I'm for universal health care, and I would like to just see everyone have the same amount of health care, which is good and which will insure all of us. But I shudder to think that I would not have had health insurance when I came down with cancer. So I think we just need smart government. We need representative government. We need to take responsibility for our government and then push our government to do the right thing.
I'll add a couple of things, and thank you for your question. I agree with what was just said, and I also feel, getting to the aspect about individual versus society doing, or government doing something, that part of the problem that we have as society with regards to promoting the health of people is that as a society, the healthy way, the things that keep us healthy, and I don't mean healthcare doctors, I mean living in a healthy place, environments that promote our health, are not the easy way. And what we need to do as a society to promote the health of everyone is to do things in such a way so that the healthy way is the easy way. Right now, the things that drive us to behave are frequently things that where other people make a lot of money, but don't result in health for us. And so as a society, for me, and as the way to move forward and keep us out of emergency rooms, we really need to do things differently that promote the health of everyone and make the healthy choice the easy choice. And that will require doing things differently, not too much differently than what we do when we say, well, it's dangerous to drive 100 miles an hour, so let's get some speed limits. And we know that when we reduce the speed limits, we save lives. May not make everyone who wants to go fast happy, but it certainly saves a lot of lives. That's the kind of approach that is one that promotes prevention, which is one that I ascribe to.
Can we have one final question and then we proceed to the refreshments?
Of course. So hello, my name is Ethan Trumpfield. I'm a freshman here. I'm a student of Dr. Brown. Now my question is for anyone on the panel, and it is that a common argument that I've heard, and I think many of us here have heard, is that the U.S. does not have a healthcare system, but rather a sick care system. In other words, because of the inequitable distribution of healthcare due to one's socioeconomic status or immigration status, people don't seek healthcare or help from physicians until they are unbearably ill. Now, this phenomenon of not seeking preventative healthcare is only more prevalent among immigrants due to poverty or language barriers. So my question is, how do we overcome this hesitation to seek care and instead encourage preventative health care, especially among immigrants?
Excellent question. And I guess in some ways it goes to our values and valuing, for example, that everybody have access to care, one. So we have to prioritize that as a public, as a social value. The other thing I feel, is, especially with regards to immigrants, is the issue of legality. It distracts us from that underlying social value of everyone having access to health care. sometimes there's a sense, and people talk about how, well, what we need to do is we need to make, have this link that legality then gets you access. We need, in my humble opinion, we need to separate those two. And with regards to your question related to health, we need to ensure that everybody here has access to care for the very reasons you talk about. And access means a location that can be reached, affordability, and quality also of care in a context where people feel safe and trust we are being seen, that enable them to want to go there.
Okay, I know there are other questions, and unfortunately we are beyond time. I would like to thank you to begin for coming tonight to the conversation, which of course continues. I don't think we have solved all the problems, though the suggestions that were brought forth were very, very valuable. So I want to thank Dr. Rodriguez for coming, and of course Dr. González-Andrieu for her remarks, and obviously for her work here at LMU. I also would like to thank the folks at the Bioethics Institute, Gigi, David, Jared, Kara, and Nia for setting up this beautiful event. So now we can take a little break, and we can certainly continue talking about healthcare distribution, but the issue will be the distribution of goods outside, meaning drinks and whatever is there. So thank you very much for your participation.